Hi, welcome to Mino Health AI Labs. So today we are very excited to show you something that we spent almost 2 years working on. So we're calling this Moremi AI. This is an AI system. It's a foundation model, or better yet, let's say a generative AI system for healthcare and biology. So essentially, we've built two versions of this AI system. Within the healthcare side, we now have an AI system that can do everything from medical diagnosis, medical screening, forecasts, prescriptions, treatment planning, and then triage, and several things along the healthcare delivery pipeline. The AI system is able to support these different tasks for several medical diseases and conditions. We are talking about 10 different types of cancers. We're talking about infectious diseases and non-infectious diseases. The AI system provides support for all of this. Then the version that we have for biology, the AI system is able to support the designing of drugs, the designing of antibodies, and even potentially vaccines. And it can also do several other biotasks. So being able to analyze genomic sequences or a vast amount of multi-omics data, we can potentially support all of this. And what we have created is essentially the world's first product that is a general purpose medical assistant. So this is not some demo project, it's not a research project, an actual product. And it took us almost 2 years to build it, so we are super happy to be launching this and sharing Moremi AI with you. So come along with us and see all the different things Moremi AI can do. Hi everyone. So we are very excited about what we've built with Moremi AI. We've essentially built a general purpose AI system that could serve as an assistant to clinicians, but also serve as a tool that provides preliminary medical information to any health seeker. So a patient, someone in the general public, and also serve as an assistant or a learning, especially a learning assistant to medical students. So I'm going to start off by showcasing some of the things that Moremi AI can do, especially within the domain of being an assistant to clinicians. So I'm going to pass in information on the patient, their demographics, then pass in physical examination, the reason why they're in the hospital. So I want to be able to use this AI system to see if I can diagnose the patient. And so after passing in everything from their demographics, so how old they are, gender, ethnicity, I'm also passing in the reason why they are here, their present illness, and then their past conditions, family history, physical examination, and lab test results. So based on all of this, let me ask the AI system, what is the diagnosis for the patient? Let's see if Moremi AI can pick it up. Okay. So Moremi AI was actually able to pick up the right diagnosis. If you look at it, it was able to pick up the patient information and arrange it in a nice format. So it took basically the chief complaints, the history of the patient, medical history, medications they are on, allergies, family history, psychosocial history, physical examination, diagnostic studies, everything from serum, blood, urine, and then from that it was able to come up with an appropriate diagnosis. So it came to the conclusion that the patient has acute diverticulitis, which is actually accurate. That's exactly what the patient has. Because Moremi AI understands the clinical workflow, it knows that you don't just stop at diagnosis. You have to then follow up with treatment plan. So without me even asking it, it came up with a treatment plan. So it did say that we should put the patient on IV antibiotics and fluids. He even suggested that we should do CT scans of the abdomen and pelvis to confirm the diagnosis and then assess for any complications. So even though we're able to look at the lab test results to look at what is wrong with the patient, it is not enough. We could go a step further to confirm with CT scan. So it's good that the AI system recommended that. And they also give some other things like we should monitor the patient's vital sign and then give the follow-up. So Moremi AI is able to essentially look at the patient's whole medical record, look at their lab test results, physical examination, symptoms that they reported, all of that to do diagnosis. But then it also comes up with treatment plan, right? Let's see if we can push Moremi AI to do more of an end-to-end healthcare delivery. So I'm just going to ask it to see if it could recommend some, nutritional food that the patient could also eat. So not only the treatment that's a concern with medication, but what are some lifestyle changes they could make? What are some things that we can pick up from nutrition and dietetics that will be helpful to the patient? So I'm going to use the voice feature. What nutritional food would you recommend for the patient to help with their recovery? Explain why each of the food will help with their recovery. Okay. I'm gonna remove that. Okay. And then put a question mark here. Then let's see what the AI system comes up with. So Moremi actually looked at everything we had given it, ended the diagnosis and made a treatment plan to now generate a nutritional meal plan for the patient. So if you look at it, for example, it came up with suggestions that general guidelines, they should go for high fiber foods such as whole grains, nuts, seeds, and then they should be consuming well-balanced diet. They should drink a lot of fluids to help with digestion. Then he actually went into breakfast options. So they should be going with oatmeal with low fiber fruits. Then also they could go with boiled eggs with toast, smoothies made with low fiber fruits too as well. Then also it went into lunch and dinner options. So we have grilled or baked fish with chicken, steamed or boiled vegetables. We also have vegetable soup. There are a number of stew options also here. Then it came up with snack options and then the dietary restrictions, which is very interesting. So essentially it's saying that they should avoid high fiber foods such as whole grains, nuts, seeds, legumes until the patient's symptoms have resolved. Then they should also limit high fat and spicy food as they can exacerbate their symptoms, and avoid alcohol and caffeine as they can irritate the digestive system. So because diverticulitis is essentially a gastrointestinal condition, the AI system is able to recommend foods that are healthy. So on one hand, foods that are healthy that will help with the recovery process, but it's also helping it avoid recommending foods that would exacerbate the condition of the patient. So let's say maybe I wanted it to explain why I recommended each of those items, how helpful they are. I could ask it, explain why each of the meals are helpful to the patient for recovery. So it went through all the categories. It took breakfast option and said that oatmeal with low fiber fruits, as well as low-fat milk and yogurt, and he explained the nutritional value in there. So if you take oatmeal like this, a good source of complex carbohydrate and fiber. And then he explains how it can help to regulate blood sugar levels and provide energy. And then the fruits are also easily digestible and they provide essential vitamins and minerals. And it does this for every single food that it recommends. So if you take the egg, they're a good source of high quality protein, which can help with tissue repair and immune function. And so then it goes into the toast and rice cakes. They also provide carbohydrates for energy, while avoiding high fiber options that may exacerbate the symptoms. Then it went into for the smoothies as well, as they would be very useful. You have the low fat milk, which also adds protein and calcium. The protein will provide additional energy for muscle repair. Yeah. Then for the lunch, it does the same thing. For the snacks, it does the same thing. So essentially, we now have recommendation on what nutritional changes the patient has to make to help with their recovery. We also know some of the food they should avoid, because the AI system recommended they should avoid high fiber food, they should high fat food, as well as alcohol and caffeine. So let me try to find out what about physical therapy, right? So what exercises, yoga, massages, and other forms of physical therapy would you recommend to the patient? So actually, Moremi AI was able to recommend some physical therapies as well. So if you look over here, it goes with the exercise recommendations. It recommends low impact aerobic exercises. So everything from walking, swimming, cycling, which would help the patient to improve their cardiovascular health and overall fitness without putting excessive strain on their digestive system. So it's not just giving generic recommendations, it's still based on the patient's medical records and then their current diagnosis. And so then it goes into gentle stretching too as well. Then Pilates and core strengthening. So it explains that by the patient doing Pilates and core strengthening exercises, it would help them to strengthen their core muscles, which will support their digestive system and promote healing. Then it goes into yoga too as well. So the AI system recommends gentle yoga classes that focus on stretching and relaxation. And so this would help them to reduce stress and improve overall well-being. And so then it goes into the breathing exercises. So it mentions pranayama. And so this will also help to reduce stress and promote relaxation. For muscle recommendations, the AI system recommended therapeutic massage. And so it recommended a gentle therapeutic massage that can help to reduce muscle tension and promote relaxation. And so it did mention that you should choose a massage therapist who has experience working with patients with digestive issues. So you don't want a massage therapist that is going to apply too much pressure, and that would only exacerbate the condition. Then it also goes into abdominal massage, which will help to improve digestion and reduce bloating. And it's also very important that you avoid deep pressure or manipulation of the abdomen during massages. Then for physical therapy, also goes into posturetic exercises. So it mentioned that this will help to improve the posture. And, so talking about posture, I should have a good posture while sitting down. So then also highlights this will reduce pressure on the abdomen. And then pelvic floor exercises are also recommended to support the digestive system and promote healing. Then it adds precautions and consideration that before the patient does this, they need to consult with a healthcare professional before starting any of these new exercises. And then they have to always start with a gentle, low-intensity activity, then gradually increase the intensity and duration as tolerated, which is a very key information. So you start very gentle. If it is manageable, then the patient can increase this. Once it starts to become too painful, they can just stop. And then they should avoid activities that cause discomfort or pain in the abdomen. Exactly. So Moremi AI essentially can go from patient's medical record, their lab test results, to then do diagnosis. Then from the diagnosis, is able to generate a treatment plan. This will involve everything from medications to other things that will be done in the hospital. But what about lifestyle choices? It can also recommend nutritional food that they should consume and food they should avoid. But then it doesn't stop there. We could also go into physical therapy. What sort of exercises? We could also ask the AI some what other lifestyle choices should they make, and it will still do that. So the benefit of Moremi AI is this end-to-end healthcare application right here. It's not just doing diagnosis, it's not just doing treatment, and it's not only doing nutrition and dietetics, physical therapy. It's doing all of them chained together for the same patient. So we are given, this is as personalized as healthcare can be once we are leveraging Moremi AI. So this is one phenomenal application, and this could be used in several use cases. We could add several other elements within the pipeline and make it much, much more complex as far as end-to-end goes.
My name is Daniel Jima. I'm a licensed diagnostic radiographer in Ghana, and I work as a diagnostic radiographer at RAD Diagnostics Limited, Koforidua branch. At RAD Diagnostics Koforidua, we perform a wide range of diagnostic tests. We do CTs, we do X-rays, we do ultrasound. We do some specialized form of X-rays as well, such as HSGs, MCUGs, RUGs. We also do mammograms and endoscopies as well. So one of the challenges identified when it comes to the delivery of healthcare as far as medical imaging is concerned is patient waiting time. And this is primarily due to the fact that there are less radiologists in Ghana, and more diagnosis centers, more hospitals need these specialists to report on their cases for them. So oftentimes patients would do a procedure. The procedure itself may not take so long, but then they may have to wait for hours, sometimes days, before they get their report. So Moremi AI actually came in to help. It came in to reduce the patient waiting times for us. So what we do is that we use a platform, the Moremi AI platform, to generate medical reports for some of our patients, not all our patients though. So some of the radiographs visibly from the radiographer's perspective are normal. In instances like that, we just run them through the Moremi AI platform to generate a report. And then now we can send it to radiologists to just confirm whether indeed what the AI platform is giving us is so or not. And this has greatly reduced how long patients have to wait for their reports to be ready and delivered to them. It has made a lot of patients happy because now they know when they come, they wouldn't take so much time before they can get their report. I love technology, and in fact, it's more reason why I chose this profession. So when we have a lot of technological tools that help your line of work, I fully embrace it. And I think the Moremi AI platform actually does that. The workload on radiographers, the workload on radiologists themselves is too huge. The platform can actually assist. The platform can help reduce the workload of these specialists. There are instances where you would need a specialist on site for a particular case. And in another instance, you may not necessarily need a specialist on site. For example, in an instance where a person just does a chest X-ray for a routine screening examination, you don't necessarily need to get a specialist to report on it. The AI platform can do that. However, still a specialist would have to confirm whether indeed what the AI platform is saying is true or not. So sometime in 2022, I got an information from my boss, who is an interventional radiologist, that there was going to be a collaboration between Mino Health AI Labs and RAD Diagnostics Limited. Mino Health AI Labs is a developer of Moremi AI platform, which is a medical imaging AI platform that is used to analyze radiographs to generate a report, a medical report. So he informed all the radiographers on site, and then we welcomed the idea because we realized that it was going to actually reduce the waiting times of patients, even though it was in the production stage and we knew that it probably would come with some challenges. However, we accepted the challenge, and then we started the use of the Moremi AI platform in 2022. Initially, it wasn't too good. We had a number of challenges. We reported all those feedbacks to them, and then they did a marvelous work by improving on the platform. And as I speak now, the platform has actually been improved to the extent that we can use it to do a wide range of diagnosis, ranging from X-rays, mammogram, and I'm particularly happy about how it's able to analyze the mammograms. So we are benefiting greatly from the Moremi AI platform, even today, and I can speak about 3 or 4 benefits. The first one is that, as I've already mentioned, it has reduced the waiting times of patients. The other thing too is that now we're able to generate the medical report faster than how we used to do it. Thirdly, now there's a reduction of the workload on our reporting staff, those who actually work on the reports, because they don't really have to manually input everything. The AI platform helps them in a way. So it's like 50% of the work is done for them. And that's a great help. Even though now some patients are skeptical when we use AI platforms to generate their report, I'm sure that pretty soon they will be able to understand and come to accept that the Moremi AI platform is superior to any other AI platform that we can use for medical report generation. And so they will maybe be okay with using that platform to generate their report for them. There are a number of nice features about how the platform is able to analyze mammograms. One, it's able to detect if you have put 2 images side by side, to be able to know that this is the right breast or this is the left breast. Again, it's also able to give a categorization of if there is any lesion or a mass. It's able to give a categorization using the Biomedical system. And then again, it's able to identify even sometimes the minutest masses. Sometimes it becomes even difficult for we, the humans, to even pick it up. But it's able to let us know that there's a suggestion of a lesion in a particular area of the breast, which we'll have to take a second look at. So all these features actually make it very convenient for us to use the Moremi AI platform to do mammogram diagnosis. Well, for the future, I think Moremi AI platform is here to stay. And I'm just hoping that sooner or later we'll be able to adapt it fully and use it to its full capacity. However, it is important to note that the Moremi AI platform has not come to replace specialists. It has not come to replace radiologists nor interventional radiologists. Clinicians actually use it to facilitate their work. So even though the Moremi AI platform can give diagnosis, that diagnosis is not a final decision. There's always a specialist on hand who confirms whether indeed the diagnosis from the AI platform is true or otherwise. And if otherwise, they actually give the diagnosis. So we do that just so we make sure the right things are done, for us not to trust the AI platform so much such that we take it over and the decisions that the AI platform give us over the decisions that the specialists actually give us. Alright, so let's try with a different image. So I still click on this button here, I upload a new image. Then I choose, let's see this, just click on OK. But this time around, we are not going to give it a prompt. We'll just click on this generate report button here for it to generate a report. So let's do that and see. Okay, a request for recent information. So we have recent in here. Age is 65. Patient ID. Let's give it this. It's a male. The modality is a chest X-ray. There was a PA. The reason for very large pneumonia. Then the clinical history. This patient presented with difficulty in breathing. Okay, so after filling this form, you click on continue, and then again we allow some time to pass for it to generate the report. Okay. So this is the format that it gave us. So So the findings, we have lines and tubes here, so there are no lines and tubes detected. This time around, as for the lungs, yes, there is a lung opacity. There are some opacification here. You can see a similar one to in the upper lobe of the right lung. There seems to be a small pleural effusion on the right side as well, so that's also captured. The mediastinum is enlarged because we have the aortic nerve also being prominent over here. And then the heart, the cardiac shadow, let me measure this one to be sure if indeed. So we have 5.2. 9. 5.2 divided by 9. That's 0.57. So it was able to capture the cardiomegaly as well. As for the bones, yes, the spine look normal. So the bones are no abnormality detected for the bones, the ribs as well. So that is fine. So the impression gave us cardiomegaly, lung opacity, effusion, and enlarged mediastinum. This was actually impressive. But then I can still go ahead and edit this. Let me add a few things to it. I have the facility name. And then the reporting doctor. So, just save the changes and then download the report. So the report is downloaded. Let's check. Okay. And then now we have our medical report here. So usually at this point, we'll send this report to the radiologist for him to confirm whether or not what the AI platform is giving us is actually so or not. Okay. So let's try with a different mammo. Let's try with this one. Okay. So this image is the CCV with a lot test of the 65-year female represent left breast pain. All family history of breast cancer. None. Please analyze the image. Correspond with this. So I click on enter and allow some time to pass. Okay, so here it mentions classifications, yes, which you can see those particular classifications here. Let's see. Well, it also mentions that we do a biopsy. I'm not too sure which lesion it is talking about that we should do a biopsy for. However, we can see a lesion here, and then there's a suggestion of a lesion to here and here. So maybe that's what it's making reference to, that we should biopsy. So I think this time around it did a pretty much good work. I'm really impressed it was able to detect this classification though, because it's usually difficult for for you to detect it. This time around, it did a very good work.
Hello guys, I am Jeremiah and I love Moremi, especially for the fact that it was developed right here in Africa, Ghana. So I have some conditions, some pains that I want to see if Moremi can pick up. So let's see if Moremi can pick it up. So here I am having shakes in my mobile parts, hands and feet with severe brain pains. What is your diagnosis? Let's see what Moremi will say. Okay, so I have Parkinson's disease, I have essential tremor. Wow, this is amazing. And then giving me recommendations. So actually I consulted with my doctor and my doctor confirmed tremor, and then also listed some causes which could be anxiety, stress, and then the model is picking it up. That's quite impressive. So actually I could ask a follow-up for some kind of treatment and see if that also matches what my doctor said. So let's see about that. So I would say, what treatment can you give me in case it's tremor, just as my doctor said? Okay. Oh, anticonvulsants, right? Yeah, so I was actually giving an anticonvulsants, but there are other, options like, forgive my pronunciation, benzodiazepine. So I'm not a doctor, but impressive what Moremi is picking up here. Yeah.
Moremi AI is actually really good at a number of use cases. One of the ones that I find very useful is that it is actually good at doing a number of things in cancer. So it can be used for screening cancer, it can be used for triaging cancer, diagnosing cancer, and even doing prognosis for cancer. And we all know how severe cancer is and how it ruins life. So being able to have an AI system that can do this is really important. And the cool thing is that I always say, essentially, looking at the cost factor in this, if you use Moremi AI, you can detect cancer for 5 cents. Basically, that's how much it costs to detect cancer using Moremi AI. So why don't we look at some use cases within the cancer space? I'll start with cervical cancer. So I'm just going to select an image I have over here. Okay. So I'll just ask the AI system, I have a question here. I'm asking it if the cell patterns in the image show high squamous intraepithelial or low squamous intraepithelial lesions. So this is connected to cervical cancer. So let's see what the AI system would say. Yep. Yes. So the AI system was able to pick up that there is actually patterns that exhibit high squamous intraepithelial lesions, or HSIL. And this is usually indicative of an increased risk of cervical cancer. So not only is it possible to detect cervical cancer when it develops, you can actually detect early signs of it. So you can detect HSIL, which could lead to cervical cancer. So it's interesting to see that Moremi AI could pick this. And using something like this could be the difference between life and death for some people. If you can pick this up early enough, you can prevent a lot of things. You can easily start with the treatments. And so it didn't stop from there. I actually went on to explain a bit more. Talks about the fact that there's increased nuclear to cytoplasmic ratio, irregular nuclear contours, and increased mitotic activities all present within the cells in the image. So it goes into details to explain. It doesn't just say yes or no. Perfect. So let's also try risk assessment for another condition, that type of cancer, thyroid cancer. So I'm basically going to ask the AI system. I'll give it a patient case where I have a patient, a 61-year-old male patient who smokes. They've undergone radiotherapy before. They've been diagnosed with clinical hyperthyroidism. They exhibit multinodular goiter upon physical exam. And also they have a hetho cell findings classified under high risk at stage IVA. How likely is the risk of thyroid cancer recurrence? We want to see if the patient has a high likelihood of having another case of thyroid cancer. Let's see what Moremi AI would say. So it's actually assessing it based on different factors. It picks the age, and it says for older patients, generally they have a higher risk of recurrence. In this case, the patient is 61 years old. Then it goes to their smoking history. It's a well-known risk for thyroid cancer. It goes to radiotherapy. The fact that they have previously undergone radiotherapy can increase their risk of recurrence. Then also the multinodular goiter. So it explains that the presence of this can also increase risk. The hetho cell findings also increases the risk of recurrence, then the stage as well. So out of this, it comes to a conclusion. The patient risk of thyroid cancer is high. So it's not just a yes or no if there's a risk, it's ranking it, it's high. Based on everything from the advanced stage aggressive cancer subtype, the smoking history, previous radiotherapy, or increase the higher likelihood. So this is a good way of knowing if a patient who has experienced cancer has a high risk of recurrence or not. And so this is another useful medical use case for Moremi AI. So another thing Moremi AI can also do is analyze lab results for essentially diagnosis or prediction of cancer. Is here. We're going to ask Moremi AI. So looking at certain factors, I have a patient here that is 45 years old. Their BMI is 29.38 kilograms M2. The glucose level, I have insulin level, and a number of other recordings that we got from lab test results. I want to see if this correlates with the risk of breast cancer. Can we rank their chances of developing breast cancer? So it's currently analyzing the different lab results. It's picking each component. So it went to age. It says, for example, at the age of the patient being 45, there's no significant risk for breast cancer. Then it looks at their BMI, and for BMI it says a higher BMI is usually associated with an increased risk of breast cancer, especially for a post-menopausal woman, a woman that is over 40 would fall under. And so it mentions that the patients, looking at their BMI, they are overweight. Then it also looks at the glucose and insulin level, which is looking at, so elevated glucose and insulin levels can be linked to an increased risk of breast cancer. And then it mentions that their glucose level is within a normal range. her insulin level is slightly elevated. Then it also looks at the hormone score too as well, the leptin, looks at everything else. So essentially, Moremi AI was able to analyze each of the lab test results and come to the conclusion that there's some risk factor associated with breast cancer present here. So looking at their age and BMI, and then the fact that their insulin level is slightly elevated, but the other things seems to be within range. So so essentially the patient might not be at a very high risk. But so there's another useful use case as far as Moremi AI is concerned. So for the next use case, we want to see if Moremi AI could help also analyze lab test results towards identification of heart diseases. So I'm going to pass it this case. I have a patient who is 60 years old, female. They have chest pain, they are symptomatic. I have also their blood pressure over here, their exercise, angina, thallium score, cholesterol, ST depression, max, and everything. So I'm asking it that based on this lab test results, is there any probability for heart disease? So let's see. The same way the AI system will analyze each of these factors. So it takes the age and says that the age of 60, yes, there's a risk factor. Then also it looks at the gender, then it takes the blood pressure, and it says that a blood pressure of 150 is considered high and an increased risk of heart disease. Then it looks at their cholesterol, looks at each of them, analyzes it. So it says, taking all of this into consideration, it is probable that the patient has a heart disease, because it further recommends that the patient should consult a cardiologist for further evaluations and management. And so some of the changes they could do is lifestyle medications. And I could, of course, just ask the AI system what medications it will recommend, and we'll do exactly that too as well. So yes, Moremi AI is capable of handling this too as well.
Hello, my name is Ata, and I like Moremi AI very much. I like Moremi AI because it was built in Ghana by Ghanaians, and it's an African product, and I'm proud of it for that. So I have known someone who has suffered a medical condition recently, and then they went to the hospital and got diagnosed. So I wanted to try Moremi AI with the symptoms the person was having, to see if Moremi AI will be able to catch that the condition. Now, if it is able to catch it, I also like to ask you further questions about the medication that the person was given to. So I'm going to go right ahead and ask the question, and then we'll see what it will say. Do you know what condition is associated with involuntary muscle movement and stiffness of the neck? Okay, so I was able to get that through. It says the condition you are referring to is likely torticollis, which is characterized by involuntary contractions of the neck muscles leading to a stiff neck and abnormal head position. This can be associated with a condition called cervical dystonia, which is a type of dystonia that's affected. Okay. I'm really impressed here because I wasn't expecting it to get it, but then it actually got dystonia. So dystonia was a condition that my friend was diagnosed with. Moremi is saying here is cervical dystonia, but then for my friend it's not actually cervical, it's a general dystonia, so global all over the body. Cervical is mostly associated with the neck muscle. So torticollis is the medical term used to refer to like the neck turning to the side. That's interesting. So the model just goes on to talk about some treatment options for dystonia, and it mentions botulinum toxin injections, physical therapy, medications. And so for this friend in question, they got some medication. So the model here says certain medications such as muscle relaxants or anti-cholinergics maybe help reduce muscle spasms and improve movement. So for my friend, they got muscle relaxants. So I'm just going to ask the model what muscle relaxants it thinks would be good for treating the dystonia condition, and then let's see what it says. What muscle relaxants would you prescribe for my friend to use? So you didn't get the relaxants I prescribed. Okay. Well, this is interesting. This is as an AI medical assistant, I cannot prescribe medication directly. However, I can provide you with some commonly used muscle relaxant that may be prescribed by a neurologist or movement disorder specialist for the treatment of cervical dystonia. Alright, so that's nice and interesting because it doesn't want to take the position of a doctor to give you like a certified answer that you work with and then have issues with later. The model says now that it's a medical assistant and it cannot provide medications directly. However, it can give me some commonly used relaxants that may be prescribed by a neurologist or movement disorder specialist for the treatment of cervical dystonia. So let's go through the list and then I just read based on the information I have for my friend. So he mentions tizanidine, baclofen, cyclobenzaprine, clarisoprodol, and that is all that is mentioned. Okay, I guess all these are okay, but this is for the GABA range, the baclofen from the GABA range, so it's also used for the treatment of dystonia. But for my friend that I'm talking about, they got clonazepam, the muscle relaxant that they got, and it's one of the commonly used ones as well. But the model was able to mention some muscle relaxant, so I think this is good enough. So I think I would want to, if I was my friend or if I wanted to advise my friend, I would want to ask more about the drugs that they were given for the treatment of their dystonia. So I just want to ask the model what it knows about clonazepam and then if there are some side effects of it. I'm just going to send that to the model and then let's see what it says. So you see, clonazepam is a benzodiazepine medication that is commonly used to treat various types of seizures, including absence seizures, and to help manage panic disorder as well as certain movement disorders such as dystonia. That's a fact. It works by enhancing the activity of a neurotransmitter called gamma-aminobutyric acid, which helps to reduce abnormal muscle movement and seizures. So, like it said, the gamma-aminobutyric acid range, you see that one of the drugs that it mentioned earlier, the baclofen was also in the GABA range, so which means it's really right on what it's saying. I'm not a medical expert, but I can see that it's providing consistent information. So for the side effects, it's like as with any medication, clonazepam can have side effects. Some common side effects of clonazepam include drowsiness, confusion, dizziness, depression, memory problems, tiredness, etc. Uncoordinated body movement. So, this is good information because I think for my friend that I'm talking about, they got fluoxetine, another drug in association with the clonazepam, and then they were having some side effects similar to this with the fluoxetine, so they discontinued it for them. So the doctor stopped them, but this information is good enough. So once he was taking the drugs and then he realized what was happening, some of these symptoms, then they stopped taking them. But I think I am impressed so far with the way it's been able to diagnose my friend's condition. So I'm impressed.
Here, and I think Moremi AI has been really fascinating for me. I've been using it quite well, I've used it for a lot of tasks, including its main purpose, that's for the medical domain, and also coding and even design. I did some simple front-end designing recently, and I'm really impressed by the way it does stuff. Recently, as you can see, my hand is wrapped. I had an injury, and it was a dog bite. Okay? Funny enough, it was my own dog from my house. Yes. So when I had this injury, I had a picture of it. Actually, my main purpose was not to send it to Moremi AI, but afterwards I said, well, why not? We've designed a very beautiful AI model that's in the health domain. Why don't I try it? So I have the image right on my PC, and I'm going to try it out. I'll quickly upload it. Hi, I was bitten by a dog. Okay, so that's just what I had to tell it, and it's showing me the right procedures I should take. I should take first aid before anything else, and I think that's fine. There's seek medical attention. But one thing is mentioned that I'm really happy with is the fact that it said I should monitor for the infection. And it also said I should remember to always wash my hands. But one thing I'm afraid of is that I might get infected. So I want to quickly ask how or whatever might happen if I don't cure this infection. So I'm going to try something like, what can I get infected with? Okay, you hear dog bites, the first thing that comes to your mind is rabies.
That's rabies, yeah. That's quite impressive.
So I'm really interested in knowing the number of shots I should take for this anti-rabies vaccine. Okay. Well, this is exactly as I know it.
It's quite impressive.
Yes. So yes, indeed, on the first day, that's when I visited the hospital, and that's when I took the first shot. And this is perfect. This is perfect. So the first day, I'm required to take a shot. Then day 3, day 7, 14, and 28. So which means tomorrow I'll have to go to the hospital to take the next shot.
Oh, okay. So compared to what the doctors told you, if you compare the information or what Moremi AI is telling you, what the doctor is telling you, how similar are they, or how good is Moremi AI compared to that doctor?
This is literally what the doctor told me. This is literally what was written for me.
Indeed.
But the information that's captured here was actually not given to me by the doctor. I was just told, well, come back tomorrow, come back on this day for this shot. But as you can see, it has provided a lot of information for me to know. So I'm really impressed that it has told me this. Yes.
That's really impressive, yeah.
It's really amazing.
Yeah, quite impressed by this. Yeah. So I want to look at the last test, and that is with protein-ligand binding prediction. Yes, that's what I mean, protein-ligand binding prediction. You know how relevant it is to have an idea of whether ligand will bind to a particular protein. So I want to show how Moremi AI will be able to assist. What you need is to identify your protein and then ask Moremi AI whether it will be able to identify a ligand that will bind to the protein. Just as we would like you in this kind of research to supply compound representation in smiles, in the same way here too, amino acid sequences are used in this step. So I would like to ask this particular question that Moremi AI should consider the following amino acid sequence, and then I ask it whether it can predict a ligand that could bind to this particular protein. Let's see what Moremi AI will say. Right. Okay. Yeah, wow. Wow. We've already done this in one of our recordings. We've shown that Moremi AI is able to describe proteins, look at protein question answering, and give specific details about it. Here, we are looking at the amino acid sequence, and I'm asking whether it can identify a compound that could bind to it. And look at this, tell me about the amino acid sequence, saying that this is part of the human protein tyrosine phosphate non-receptor type 1, PTPN1, also known as SHT2 domain, containing protein tyrosine phosphate 1, SHP1. It is a non-receptor protein tyrosine phosphate that plays a crucial role in various cellular processes, including signal transduction, cell growth, and differentiation. The protein is involved in the dephosphorylation of tyrosine residues on target proteins, which helps regulate their activity and function. Now, it's now coming to answer my question. This is just wow. It tells me about the sequence I provided and then talk about the ligand that could bind to it. So it says that this ligand is what I have highlighted here, the compound represented by the SMART. Now, you can easily verify this compound by double check in external repositories such as ChemBL or even PAP and other repositories as well. Now look at what it's saying. Moremi AI is telling me that this compound is to interact with the protein through specific amino acid residue, thereby modulating its activity. So it kind of suggests that what you see or the report that is being generated is not actually random, and this is just too good for those in computational research, be it in biomedical informatics, bioinformatics, cheminformatics, and whatever area you want to use the computer models to support your scientific research, as long as it's a biomedical research. Don't look any further. I think Moremi AI will give you the best choice, especially giving you insight and providing guidance in whatever you are going to do. Now, I just did these few demonstrations, but you will understand that these are not the only things that the model can do. You should just test them out yourself and see how best the model could support you. I can bet that it can support you by giving you basic understanding on biological processes. And then you can also leverage on these capabilities to provide support to find therapies for emerging diseases. These are things that myself as a researcher I'm looking into, how best it can provide support for patients who are involved in COVID and other infectious diseases. Thank you and enjoy as you use Moremi AI.
Yes. Okay, so this is how we use the Moremi AI platform. So I've already logged in. So I just click on this upload button here. Then I'll upload a new image. So let's look for this patient. Comfort. Okay. So we upload and then I give it a prompt. The image below is the chest X-ray of a 67-year-old female patient who presented to the hospital with shortness of breath. Please analyze the image to determine this patient. Okay, so after the prompt, I just click on the send message button here, and then I allow some time to pass for the report to be generated. Okay, so in this instance, it mentioned that there's cardiomegaly, there's a lung opacity, and then there's pleural effusion. Actually, two of these are correct. So there's an effusion on the right side. The cardiac shadow, when measured, was 0.56, which can also explain why it mentioned cardiomegaly here. Also, the lung opacity, there's no lung opacity. There's no visible lung opacity. However, there's one thing that it missed. The thoracic spine is moved, it's shifted towards the right side. So it could have picked up this scoliosis, but it was unable. But it did a great job. It's able to pick two out of the possible three impressions. Okay.
So, as you can see, that was just a glimpse of the different things that Moremi AI can actually do. There's several hundreds more that we are still figuring out, and we didn't have enough time to put into this demo. So we welcome you to use Moremi AI, try it out in different features, either as a patient, as a health seeker, a medical student, or even a health worker. And as you can see, it supports several medical tasks. So you can use it as a general practitioner, a nurse, or a specialist. And even a biomedical researcher could use it in several ways. So we welcome you, and the amazing thing is that Moremi AI is already live. So if you visit chat.minohealth.ai, or if you even visit moremi.ai, you could access the AI system today. And you could use it for all the amazing things you've seen and several more that we are yet to discover. So discover them and then share it with us. We are super excited that we've done this. This is the first step towards our goal of creating AGI for health. So we want to have a single AI system that can do everything in healthcare and biology, and we want everyone on the planet to have access to this. So we welcome all support, we welcome all partnerships that we can leverage to further expand this and solve healthcare and biology. This has been Mino Health AI Labs. Looking forward to changing the future and present of healthcare. Bye.